So today we're going to talk about doing TPN in the home setting. TPN is total parenteral nutrition, which is all of your food IV. The pharmacy mixes your TPN, usually days to a week at once, and delivers to the house. Then a nurse is going to come out the first day you do this, sit down with you and do some teaching, and the pharmacy is going to send information that they'll use to help you to be able to see how to do this yourself at home. Whenever you're going to be doing infusion therapy at home, and today we're talking about the TPN at home, you need to find a surface, a good work surface to do this on that's washable. You can choose your kitchen table, dining room table, the countertop in the kitchen, but someplace that you can use a cleaner and then some paper towels and really clean it up well. And just use something that's disposable that you can throw away. Now you need to go wash your hands and come back to get ready to do your TPN. So today we're going to discuss the right way to wash your hands before giving your IV medication at home. You want to choose a sink in your home that's nice and clean. You want some liquid soap that you don't refill. You don't want to use bar soap. And you want some clean paper towels available. The first thing you're going to do is turn on your water and get your hands nice and wet. Then apply the liquid soap and make sure to soap up your hands really well, all the way up to your wrists, down again in between your fingers. Make sure you get your fingernails, any areas of any physical dirt, and it's the friction that's going to get them clean. You need to do this for at least 20 to 30 seconds, top to bottom. Then it's time to rinse. Put your hands under the water and use friction again while you rinse off all the soap and dirt, making sure you get in between your fingers and finishing up from the wrist down. When they're nice and rinsed off, get a clean paper towel, dry well, in between your fingers, and use that same paper towel to turn off your water and discard. Now that you've washed your hands, it's time to come back and get the work area ready. And you want to lay out paper towels on the clean surface, and you want to get the things that you need to take out and have ready to do your TPN. I've got 2 different bags of TPN here. I have the syringe I'm going to need to pull up multivitamins. I have the tubing that I'll need to put in the bag to give the TPN, some alcohol wipes, some gloves, these are non-sterile gloves, and hand sanitizer. The 2 different bags of TPN, one has lipids in it and it's white. Some patients get this every day. Some patients get this a few times a week. This is the very same product, TPN, without the lipids, which are the fats. So once again, you could have this every day, or you could have some clear bags and some white bags, and the pharmacist will tell you which days you're going to take which. These are kept in the refrigerator until you're ready to use them, and they're fairly cold, so you need to pull them out at least 1 to 2 hours before you're going to start to do this, and just lay them on the counter on a paper towel or a regular towel, because they are sometimes damp and chilly. And you want this to be close to room temperature before you start. You cannot run them in warm water. You cannot put them in the microwave. You need to just leave them on the counter till they get to the right temperature. Now we're going to talk about putting the multivitamins in a syringe and putting them in the bag of TPN. So to do this, if you'd like to use hand sanitizer again on your hands first, If you've been touching a lot of things and doing other things since you washed your hands, you can certainly do this. And you want to get it everywhere on your hand surfaces and in between your fingers and around and close to your nails. And then you're going to use the non-sterile gloves that the pharmacy sent you that are just a good barrier between anything that would be on your hands left over and the equipment and sterile supplies like syringes and multivitamin tops that we're going to get into. All right, the multivitamin vials always come in two dark vials. One has a blue cap, one has a white cap. You need to draw up everything in each one of them into one syringe and then put them into the bag. I'm going to talk about the procedure for this. You remove the top to each of them, pops off. And the top to this needs to be wiped with an alcohol because they're actually not as sterile as you would think. And the process is to do a nice clean wipe and put it down. Get another alcohol. Do a nice clean wipe and put it down. And then I'm going to draw up these multivitamins in the syringe. This is a 10 cc syringe with a needle that screws on that's on here. And the process for drawing anything out of the glass vial is to first pull down some air. And each one of these has about 5 cc's in it. So you want to put about that much air into it before you pull it out, and it helps it come out. You don't want to put a lot more than that, and if you go much less, it is not as helpful. So somewhere near 5, I draw down air. One of these multivitamins is clear and one is yellow. It doesn't really matter which one you draw up first. But you go in and you turn it upside down and you push the air up into the vial. If you start to feel resistance, stop pushing and let go. And you see it come down almost by itself. You can push more air in and you can come down. The needle has to be down low in the vial to get all the fluid out of this. And it's hard to see it because it's dark, but you want to see the tip of your needle in this dark vial or glass container with the medicine. This is multivitamin, and you want to try to get as much of it out as you can without getting a bunch of air. And then you come out. That one's finished. Now I need to draw up the other one and mix it in here. But I am going to put some more air in this again before I go into the next vial. And you put the needle in the vial. Again, you turn this upside down, get your air in the syringe to the top, push some air in. It's feeling a little resistance. I let go. Here comes the yellow part of the multivitamins. I push more of that air in, let go, and it pulls it down. And again, I'm trying to get as much of this as I can out without getting a bunch of air with it. I just want to get the medicine in this syringe. And I'm watching and watching in the vial to get what I need. It needs to be around 10, which it is. And I don't want a lot of air in the top of this syringe. And it looks good. So I'm coming out. There's a little bit left in here, but that's okay. I have 10. Now I have to put it in here. I don't touch the needle. Another way to deal with the syringe and the needle while you're wiping the port on the TPN is to recap the needle. For that procedure, when you've drawn up all of your multivitamin and then you have the cap ready, and you gently put the cap back on, lay this down, and now we're going to get the alcohol ready to clean the port on the bag of TPN to put the multivitamins in. And I get another alcohol wipe. There's 3 ports coming out of this bag. This port is going to be where we pull this off and we're going to put the tubing into this one. The middle one with the metal clamp on it is the one the pharmacy used to fill this. We aren't going to use that one at all. This one with the rubber tip to it is the one we're going to use to put the multivitamins in. I take the alcohol wipe and I hold on to this and I scrub. I have to hold my multivitamins so that I'm ready to use them. I've scrubbed the tip and you'll see a small little circle on the rubber end to this that I'm aiming for with my syringe of multivitamins. You can see the needle, you can see that port, and I'm going straight in. And you can see where the needle's going to come in. You want to be careful, I'm going to turn this now, this way, that you don't puncture anything on your way in. You want to be nice and straight. Now I'm going to inject the multivitamins, and you can see them because it turns everything yellow. And again, if for any reason there was some air in this syringe, I don't want to put the air in the bag. I just want to get medicine. If there was any air in this, I'd hold it up straight and get the air to the top and make sure not to put it in. You'll see a few little bubbles, which I'm not concerned about. But if there was really a big bubble of air, I would not put it in this bag. So when I get to here, I'm done. Now I'm going to pull this out. And this is going to go in your sharps container. Now, we need to mix this a little bit so that the multivitamins are dispersed in the TPN fairly evenly. You don't need to shake it, just kind of moving it around till it looks pretty even is the best way to do this. You can tell that it looks pretty evenly distributed and yellow. The next thing that we're going to do is put the tubing into your bag of TPN. Now we're going to talk about putting the tubing into the bag of TPN and getting the TPN to the end of the tubing. Tubing comes in a bag. This is tubing that's specific and dedicated to the pump, and in this case it's the Curlin pump. It has instructions in here. If you have any questions about how to do this, there are instructions in many different languages right in here with the tubing. The tubing comes wrapped up with a paper tab on it that you need to break and take off and throw away. And we're going to look at this tubing for a minute and talk about it. It's all wrapped up. It has 2 ends. One end has a sharp spike that's going to go into the bag of TPN. The other end has what we call a lure lock that'll easily screw onto the end of your IV. And then on the tubing itself, you're going to see a yellow and a blue piece. These are the two pieces that we're going to have to fit into the pump. This is a filter that as we put the tubing into the bag and the TPN starts to run through, we're going to watch how it fills this filter. This filter collects bacteria, air bubbles. This is a 1.2 micron filter, and we use it on all our TPNs. Now we're going to look at this bag again. And we're going to look at these 3 ports that we talked about. This is the one we use to put the multivitamins or any other medicines that the pharmacy tells you to put in your TPN. This is the one port that the pharmacy only uses to put things in and make your TPN. And this is the port that we need to use to put in the tubing. Once we put this spike of tubing in here, we're going to push it in far enough to break a membrane in here, and the TPN is going to start running through here. So I'm going to take off the cap, throw it away, and I'm going to take off the end of this and throw it away. And you aim for this. You try not to touch anything that you take a cap off of, and you have to push and twist. And you know you've gotten it in far enough when you can see something start to move down. Once it starts to move down the tubing, you want to be ready to have it fill this filter, and you fill the filter in the direction that the tubing goes in. And I kind of have to mash on the bag to get this to run through easily, and you can kind of see it running into the tubing. It's just getting into the filter, and it's going to fill this filter. You're going to see it start to fill the filter. And then it fills the other side. And I'm pushing on the bag as I go to make it come through faster. If I don't push on the bag, it really won't come through on its own. Now I'm going to wait and watch it drip off the end of the tubing now that it's gone through the filter, and I'm leaving that blue cap on. It'll still drip around it, and I'm keeping the end nice and clean and sterile while I wait for that drip. And I'm pushing on the bag. You can see it moving. There's the drop. All right, we're at the end. I'm going to stop pushing on the bag. I'm going to come up here and I'm going to pull off this yellow cap. When I do that, it mashes down on the tubing and clamps it, and it stops dripping. There's another clamp on this tubing also, this white one. This white clamp will slide across on the tubing and pinch it. So now I've actually clamped or pinched this tubing 2 different ways. One way with this and one way with this. You have to take off the little yellow tab I pulled on this in order to get it into the pump. So the next thing that we're going to talk about is how to load this in the pump and use your IV pump. Now we're going to talk about your pump for your TPN. Our pharmacy, Pruitt Pharmacy, is going to send you the Curlin pump to do this. And the first thing I'm going to show you is how to put the batteries in this pump. The batteries go through the back. There's a door here that we're going to unlock. You see lock and unlock, and I pushed this towards unlock, and I pull down. It takes 2C batteries that we send you. They both go in the same direction, which is a little unusual. And the door goes back on. and then you lock it so it won't come off. The pump always comes programmed from your pharmacy, ready for you to use. I'm going to turn the pump on now, and we're going to look at how it's programmed from the pharmacy. This is the on-off button. I'm going to press. You hear the beeping, and the pump does a self-check. Internal power is full. That's your power source from your batteries. The first thing that comes up, it says enter to select program. Enter and yes are the same button, and we're going to hit yes to program. It says we're in the TPN mode for programming on this pump. It does other things, but we're using it for TPN today. It says enter to select. Repeat RX is already blue or highlighted versus new program under it. You will never put a new program in, the pharmacy will. So we're going to say yes or enter to repeat RX. It always shows unidentified, delay off, and it's running through this program quickly. It's been programmed into the pump. When it's all finished, it says press run to start. No to review, options are prime. Nurses and sometimes patient too says, boy, that went fast. I'd kind of like to look at that. So if you say no to review, you don't have to do this, but if you want to, you can go now line by line and look at this whole program. So unidentified comes up first. We can sometimes put a patient name in here, and that's what this is for, but we're going to leave it as unidentified and say yes. Delay is off. Next is yes. Bag volume, 1,240 milliliters is what we're going to have this program for, and that's the amount in your TPN bag. As opposed to the next thing says vol TBI, volume to be infused. So once I say yes to bag volume, it comes down to that. You're only going to give yourself 1,200. The extra 40 is going to be at the end in case you need it to run for a little while till you're ready to finish and flush. INF rate is infusion rate. This is going to run at 109.1 mLs per hour. It's going to ramp up over 1 hour, meaning the first hour this is on, it starts off very slowly, and over 1 hour it gets up to that 109.1. So I say yes or enter, and ramp, on ramp, up ramp, and this is off ramp, is 1 hour up and 1 hour down. At the end it'll do the same thing and ramp down. And this one is set for 12 hours, meaning this whole bag is going to go in 12 hours, because this is a cycled TPN where it goes on and then off. Some patients are on their TPN for 24 hours, and they're going to do a bag change once a day, and it will be on constantly. This we're going to talk about is a cycled TPN that's only running for 12 hours a day, and I'm going to say yes to that. KVO rate of 0.1 means at the very end, when it's all finished, it's going to run very slowly at that 0.1 until you're ready to stop the pump and flush your line. That's why the extra 40 cc's was in there from the total bag volume. I'll say yes to that. Am I done? Yes. Now it's back to the very beginning screen that says it's ready to press run to start. And we'd be ready to do that after we put the tubing in it. So first we have to put the tubing in this. And I'm going to open the top, and I'm going to find the two parts of the tubing that I explained have to go in this pump. There's a yellow piece and a blue piece, and on this pump there's a yellow arrow and a blue arrow where each of these little pieces are going to go. So I find the little hole for the blue piece where the blue arrow is, and this tubing comes across the pump and there's a little place where the yellow arrow is that I put the yellow piece in. And then I bring this atop and I push down and close it. Now your pump is ready to be started. And if I was hooked up, I could press run to start. But now we're going to talk about how to get your IV line ready to start your TPN. Now it's time to get your IV line ready to give yourself your TPN. I'm going to open one of the salines. We've got 2 salines and a heparin. SASH method, saline, administer drug, saline, heparin. But we aren't going to need the other saline and heparin until 12 hours from now when you finish your TPN. So you're going to leave those out for later and not open them right now. I'm going to open the saline. And you recall that your saline syringe has always a little bubble in it. And you have a choice of either the nurse has taught you how to get this bubble out, or the nurse has taught you to give the flush without the bubble. I'm going to go ahead and uncap it and get the bubble out. I'm going to uncap it and put the cap down up. I'm going to hold this straight up and I'm going to remove by pushing gently. If I have to tap and get little bubbles out, or come back down and make it again and bring my bubbles all the way to the top till I see that little bit of saline at the top. Then if you need to recap it, you can come down here and recap it and put it down. And then you're going to get ready to flush your IV line. So now we're ready to flush your IV line before you start your TPN. Your IV line has heparin in it and it's clamped, and you have your green cap or your other type of sterile cap on the end. You remove the cap. You clean with an alcohol, and that's a scrub, the top and all the way around. Throw it away. You pick up your saline, flush, luer locks on. You have to unclamp your IV line. And you slowly flush with that push stop, push stop, push stop, push stop, push stop, push stop, push stop technique. So the next thing I have to do is put the tubing on. I usually leave the syringe attached and I go get my tubing. So this is the tubing that's already in the pump and it's ready to be attached to your IV line. Get an alcohol ready if you're ready, and if you have help, people can be doing some of these things with you. You're going to remove your syringe, alcohol wipe again, remove the cap of your tubing. This goes on just like your syringe did. Just push and twist. You're still unhooked, you're unclamped from your IV line. This is your tubing that you've clamped with a white clamp. You're going to need to undo the white clamp if you clamped that. The other clamp we talked about is in the pump. You don't need to worry about that. We're going to turn on the pump and be ready to start our TPN. Batteries are full. Here we are at that first window again. Enter to select program. It's the only choice. You hit yes or enter. enter to select repeat RX or new program, and repeat RX is highlighted in blue and we're in the TPN mode. We say yes or enter to that. It runs through that program again that the pharmacy has already programmed in the pump. You will never have to program the pump. Pharmacy does it. And you get to this screen, which tells you press run to start, no to review, options, or prime. The prime mode we didn't talk about because I primed manually. We'll talk about that later. Now we're just going to turn the TPN on now and show you how this works. I'm going to press run to start. Now the TPN is running. It always shows the TPN on the side, and we call it scrolling through the program. It's constantly changing. On the window, it's showing you different things that are going on in the program. The rate, the volume TBI to be infused is still 1200. It's telling you constantly what it's doing. And in a few minutes, the screen is going to go dark. But if you touch any of these buttons, it'll light up again. While it's running, if you ever wanted to check to see how your batteries are doing, you can see that number 2 says power check or POWR check. If I press it right now, it tells me I still have full batteries. The batteries generally last 24 hours in the TPN mode. Once in a while they could last into your next bag tomorrow, but we always send you from the pharmacy enough batteries to change those 2 batteries every day. This is going to continue doing this, and in a few minutes, as I said, this will go dark. Now we're going to talk about how to prime through the pump instead of manually. Now we're going to talk about how to prime the tubing, getting all the fluid from the TPN to the end through the pump instead of doing it manually, in case you were taught to do it that way. So the tubing's in the bag, and we have the yellow and blue pieces of tubing that we have to load into this pump by opening the top. There's a blue arrow for the blue piece and a yellow arrow for the yellow piece. So I like to put the blue piece in. It's very small. It just goes into that little hole and comes out the front, comes across the top. The yellow little square goes down into the little hole for the yellow arrow. The top comes down and you close the pump. You get ready to turn the pump on. It does that self-check. Full power on your batteries. And the first screen again says enter to select, and it says program. That's what we want. Yes. Repeat RX, meaning repeat the prescription we filled this for and that we programmed the pump, versus a new program in the pump. It's always going to be yes or enter to repeat RX in the TPN mode. Now the pump runs through the program all by itself that we programmed it for at the pharmacy for you. And it gets to that screen where it's ready to either start, review it, options, or prime. And here's that prime. And the prime button is down here in the lower right-hand corner. It says primer bolus. We're going to utilize it for the priming mode. You make sure there's no clamps clamped on your IV tubing. That white clamp that we talked about that could have been pinching it should be unclamped. You leave the blue cap on the end, and you press and hold prime while you watch it run through the tubing and drip off the end. So I'm going to lay this down for a minute, and I'm going to press and hold this prime button. It says disconnect patient, release clamps, hold prime key, or yes to exit. I am disconnected. It's making sure you've done that. And it does that as a check. And then you press again, priming. And it's coming out the end. So it's run through rather quickly, and it's dripping off the end. So you let go. You may have to hold this down for quite some time if it needs to run through at a certain rate until it comes to the end and it drips. That's how to prime through your pump. When you're done, it says yes to exit. Here's yes. I exit. I'm now at the point where it says press run to start. No to review. Options are prime. Now it's ready to be hooked up to your IV line. This is the backpack that the pharmacy sent you that we're now going to show you how to put your TPN and pump into so that you can just walk around all day with your TPN. So you noticed I opened it. There's a window on the outside that I'm going to put the pump in that you'll be able to see through the window. And when I open this, that side is over here. This side's going to be for the bag of TPN that we have ready. And I'm going to open this. Here's my bag. There's two things at the top of here. One is a little clamp, and the other is Velcro pieces. You can use either one to hold on to this bag. I prefer the Velcro. I think that it actually is easier to put on, and I think it stays on better. And I just Velcro that closed, and it's holding this in place. And then these two things close up and kind of hold on to your bag. And there's a couple of long straps that are Velcro that kind of come up, and I crisscross them. And they're going to hold this bag in place. And then down here at the bottom is another little piece of Velcro. And the tubing coming off your bag can be held straight in there. Then here's my pump running. And across on the other side is a little pocket. And it has a couple of Velcro pieces. And you want to put this in upside down so that this is nice and straight. If you try to go this way, it actually doesn't face it, and if you try to turn it this way to be facing right, it twists everything. So it needs to be in upside down. And then this comes down and holds it, this Velcro, and the ones on the side come up and they hold it in place. And this is the tubing that's going to come out for me, and this is going to lay up in here for when I close the zipper. So this is what it looks like put together correctly, and I'm going to close it now. And I'm going to zip it up. This little zipper was unzipped. There's nothing in there for us right now. But this big zipper comes all the way around, and you'll notice it stops here. It won't zip all the way, so it won't kink your tubing. Okay, I'm going to pick this up. This is now a backpack that you can wear like a backpack, or you can hold it. In your ambulatory, you can move around and do whatever you want while you're hooked up to your TPN. I was going to show you how you can look at the pump once it's all put together. You'll see now that this is dark, and if I touch any button, I'll touch the up arrow, it lightens it up. And it's constantly scrolling through the program, but you can check on it anytime, even though it's all closed up. I'll hit that power check. I'm going to check on my batteries again. Oh, they're full. That looks good. The other thing I monitor if I'm the patient and I'm waiting to see how things are going, remaining. I still have 11 hours and 55 minutes of my 12 hours to go. I have 1,200 cc's still left to go in. So these are the things you'll look at throughout the time this is hooked up to see how things are going. How much longer am I going to be on it? How soon do I need to change the batteries? And then you can just close this up and use it and walk around and do what you need to do while you're on it. The next thing I want to talk about are some of the complications and things we want you to watch for at home when you have TPN at home. So one of the first complications we're going to talk about is when your pump yells at you. So I'm going to look and see what it says. It's telling me downward occlusion. And I'm going to hit that silence button and say, what is going on? And I recognize that I left a clamp on my tubing, and that's why it's having problems. It's occluding downward of the pump. So I undo the clamp and say, oh, I found the problem. And it actually started running all by itself because I did it fast enough. Once in a while it doesn't, if you don't do it fast enough, it won't automatically start to run. So I'm going to pause it and show you what comes up on the window now. For the first time you've seen a new thing. You've always seen repeat RX and program, but now you see resume and it's highlighted. Resume only comes up on the screen when there's a bag attached and it says, do you want to finish this bag? Do you want to resume the bag you have? As opposed to repeat RX would be when you're going to hang a new bag. So I'm going to say yes to resume, yes or enter, and it goes right back to our screen that says press run to start, and I'm going to press run to start. And now the pump is running the TPN again. I'm going to close it up, and I'm ready to be on my way. Now I'm going to talk about some of the other things that can happen or go wrong or have issues when you have TPN. The next thing I want to talk about is if you have TPN running and for some reason you have to stop your TPN and disconnect briefly to do something. And this comes to play more for patients who have continuous TPN. Normally patients who have the cycled TPN know that they have their 12 or 14 hours where they're hooked up, and that's usually through the night. And then during the day they're disconnected and they can take their showers, change their clothes, and do the things they need to do. But if you did have to stop your TPN briefly to do something, we're going to talk about that. So if that had to happen for me right now, I would open this up and I would turn off my TPN. I would hit pause and off. And it would turn my pump off. And then I would put on my gloves. And depending on how long I'm going to be disconnected, this is very briefly, I might not even flush. Less, just a couple of minutes is the way I'm going to do this. If you're going to do this for longer than a few minutes, you're going to also have to flush your line. But I'm going to make this where it's just going to be for a minute or two because maybe I need to change my shirt or do something and disconnect. So I'm going to clamp both tubings, the one to my pump and the one to my IV line. And I have to have something sterile to put on the end of each of these pieces while I do what I need to do. The green caps go on my patient IV line, and this is a red cap that's made to go on my IV tubing. So I'm going to get my green cap ready. I'm going to disconnect and put my green cap on my IV line. And then without touching the top of this, I'm going to open up my sterile red cap, touch it on the sides, and this skinnier piece fits on my IV tubing. Now my IV tubing I can put aside, and I can have this ready to now do what I need to do to be disconnected. If I think I'm going to be longer, again, you have to flush and use your saline and perhaps even heparin. TPN, once it's been gotten to room temperature, is only good for about 24 hours. So if you are disconnecting for hours at a time for some reason, which should be very rare, realize you only have about 24 hours from the time you've spiked this bag to use it. If you go longer than that, you have to throw it away. The next thing I'm going to talk about are the ways to keep an eye on your PICC line and monitor for any problems with your PICC line with TPN. Now I want to take a few minutes to talk about some things that you should keep in mind and watch for with your IV line when you have home TPN. Again, TPN stands for Total Parenteral Nutrition, all your food IV. It's going into your veins, which eventually goes into your arteries. It goes through your liver and kidneys, and then you urinate or excrete any of the waste and byproducts. Nothing goes through your GI tract. But because we're putting everything in the bloodstream, a portion of this for your calories is a sugar-based product, dextrose. And when you put sugar into your bloodstream, and you need that, we all eat it, and we all use it, even diabetics, you would easily feed any bacteria that was growing anywhere in your body. So if you developed a urinary tract infection or some sort of a respiratory infection, it could really get out of hand quickly when you're running TPN. Therefore, we always have patients monitor your temperature and general feelings of illness or fatigue or problems, and let the pharmacy, your nurse and physician know if you run a fever over about 100 or 100.5, we need a phone call. A low-grade fever, 99, somewhere around there, could be a virus, could just be the time of the day that you get a warmer temperature in your body, but you start getting over 100.5, something's going on. And more than likely, we're going to have you turn off your TPN, and we're going to have to figure out what's going on. Another area that could have a problem is your actual IV line. So whichever kind of IV line you have, a PICC line or a port or a Hickman, you're going to monitor your IV site. That also could be an issue. So your site should always look skin color or perhaps a little bit pink, but never red. There should never be swelling. It should never be tender to touch. It should never hurt. If anything like that's going on, something's wrong here at the site, and you need to call your nurse, call your physician, and let the pharmacy all know something's different about my IV line. I want to make sure I'm not having a problem here. So these are the things that you need to keep an eye on because you have TPN, and we could make it worse more quickly because we're giving you sugar as one of the components to this. We don't want these things to go wrong fast. The next thing I want to talk about is how the pharmacy makes your TPN based on your labs. So now I want to take a few minutes to talk about how your pharmacy coordinates and makes your TPN based on how you're feeling and how your labs came back. Your pharmacy is going to talk to you once or twice a week. They're going to make a phone call, want to talk to you and or your loved one who's helping you with this, and talk about how you're doing on the TPN. Do you have any swelling, particularly in your lower extremities? Are you feeling okay? Are you coughing? Do you feel as though anything else has changed since the last time we've talked to you? How are you doing using the pump and getting all of this going every night? Do you have any questions about that that we could help you with? How are you doing on your supplies? How are you doing with gloves? Did we send the right size? Do you have enough of the saline flushes and the heparin flushes and the alcohol wipes? Are you feeling okay about drawing up your multivitamins? Once we go through all that, we're going to review with you the labs. Your nurse probably has come out before we call you and drawn your blood through your IV line and taken the blood to a hospital, and the labs were done at the hospital, and we've gotten a copy of them as well as your doctor. And how we put the things into the TPN is based on your labs. Your magnesium, potassium, sodium, calcium, how much dextrose or sugar, proteins, lipids, and fats are always going to be based every week on your labs. And there'll be adjustments every week. We'd like to keep your labs stable and hope that there aren't a lot of changes in them week to week once we get a good formula for you. But things can change for you that make some of these components go up or down, and we have to make adjustments. We can't just send you TPN without labs. We'll always have a close relationship with the nurses who come to see you. We'll be talking to them about when they're drawing labs and where they're taking them, and we'll make sure that you know when they're coming and you're ready for them to draw your labs. The labs shouldn't be drawn while the TPN is running. So if you have cycled TPN, you'd like to have it turned off before they come and be finished with your 12 or 14 or 16-hour cycle. If you're on continuous TPN, when the nurse gets there, she's going to help you stop it. Put one of those red caps on your IV tubing, flush your IV line, and wait about 10 minutes. Then she's going to draw your labs through your IV line and then restart up your TPN with you. After about 10 minutes, that's enough time for some metabolism, and we don't get just TPN in your lab draw, we get how you're doing on it, and we'll get good results from that. Once in a great while, your IV line flushes fine, but when the nurse pulls back to get some blood, she can't get a blood return or blood to come out of your IV line, and she ends up sometimes having to draw it through your arm. If that does happen, call the pharmacy and tell the nurse that you know that this could be fixed by the pharmacy sending out a medicine, which we can do with a doctor's order, called cath flow. The nurse can put it into your IV line and help clear what's going on there that she can't get a blood return. And hopefully next time she can draw your blood out of your IV line. That's about all that I wanted to talk about today for the complications with TPN at home. Please always know that you can call your pharmacy anytime and talk to your pharmacist about what's going on or any questions that you have about your TPN. They're always available to you 24/7 for any questions. Once you've been taught how to do this, please don't ever hesitate to call and ask if you have any concerns.